Hello and welcome everybody to the eCW podcast. We're here in beautiful Raleigh, North Carolina, here at Kids First Pediatrics with Dr. Selam Bullock, one of the founders of the practice, actually the founder of the practice.
Yes.
We're here to talk a little bit about how Kids First has integrated eClinicalWorks into their daily workflow and some of the things that they're doing really well here. So, Dr. Bullock, how's it going?
Pretty well.
Yeah?
Not too bad.
Thanks for being on the show.
Thank you.
We appreciate it.
Thank you for having me.
You guys have been using eClinicalWorks for quite some time now. About how long have you been on the system?
About 6 years. We started the practice in 2008, and then 2009 we went to eClinicalWorks.
And how was that transition?
It was, early in the practice, so we didn't have as many patients on our other EMR. And originally I had actually demoed eClinicalWorks, and I wanted to use eClinicalWorks, but I felt like it was too big of a system initially, so I used practice management with a little bit of a progress note software, and then we decided that we really needed to use eClinicalWorks in order to grow and before we had too many patients on the old EMR. So the change was very easy.
And doing it after just a year of being live was probably a relatively easy transition at that point.
So we had about only a few hundred patients, so it was just easy to transition.
How many providers and users do you have here at Kids First Pediatrics in Raleigh?
We have 4 providers, and we have about 14 users.
Kids First is probably one of the biggest practices I've seen taking advantage of almost a complete suite of modules within eClinicalWorks. Could you tell us what portion of the program you're using right now?
So we have been using obviously the EMR, the PM, and we've been using Kiosk for about 3 years, and we have eMessenger, eClinical Touch, we use eClinical Mobile, and the EHX, pretty much every module that is there.
And you mentioned you're actually doing a pilot for the EHX earlier in our discussions, correct?
So we're piloting for the North Carolina HIE for eClinicalWorks. We were the first practice to go live.
It's important to be on the cutting edge of technology, as we've seen throughout your office, the integration of a lot of the iPads and equipment for your end users to be able to use.
Yeah.
With that said, you guys are huge advocates of Patient Portal and Helo. How have the adoption rates been? Are people taking to it?
Yes, actually, we have about half of our patients using the portal. We are trying to increase that by using Helo because we are in the part of Raleigh where we have a large patient population that does not have internet access at home. So, and also with us being a pediatric practice, Helo is perfect because you can have multiple children in one app. And so we've been really pushing Helo, and a lot of our patients have really enjoyed it and liked it.
Okay, so if you're a parent with multiple children, it's one log on to be able to manage multiple accounts, nice and simple for them.
Yes.
And with that said, do you think that there's going to be kind of a big move more toward the mobile platform than personal computing at home with your own internet connection?
Yes, yes.
Yeah.
I mean, pretty much everybody has a smartphone, and most people, that's their main method of getting information anyway. So I think that eClinicalWorks went way earlier than most people, and I adopted Helo and started talking to our patients about it like more than 2 years ago when it wasn't highly publicized. So we've been like one of the first users, and it's been one of the best apps. And as a matter of fact, recently, after one of the conferences, I was talking to my next door neighbor how our secret to success has been using technology and healthcare technology to its best, to its fullest capability. And of course, there's still room to grow. And he said, "Oh, speaking of health information, let me show you this app that I have with my doctor, and it's called Helo." And he opens it up and he goes, "I can message my doctor," and that tells you it's actually gone big, because North Carolina hasn't been a huge eClinicalWorks. Allscripts was based here, so that we had a lot of practices, but now it's picking up a lot more. But for my next door neighbor to be going to a practice that's using Helo was pretty cool.
Well, and of course you one of them, but we do have many vocal pediatric providers specifically in North Carolina, and that's been kind of a big thing that I mean, ourselves, we actually met at the users conference last year in Orlando, and kind of got the ball rolling by discussing a couple of pediatric things, which led us to something that we'll get into a little bit later, something that we've both been working on for the last year or so.
Well, one thing also with North Carolina has been one of the two states that was granted a CHIPRA grant for pediatric EMR functionality, and this is supposed to be in the future works of meaningful use and things like that. So I've been involved in that grant by going through and trying to figure out what pediatric functionalities are important and clinically useful for any EMR. This is a multi-EMR grant. So eClinicalWorks has signed on with that and has been working with us to try to improve the pediatric functionality. So the other state is Pennsylvania and North Carolina.
And again, that was one thing that kind of connected us and which led us here to talk about all the good things that you guys are doing at Kids First.
Yes.
So aside from Patient Portal and Hilo, which again has really helped your guys' patient-doctor rapport, I mean, I've noticed when we were looking at the system earlier, you had a couple of web encounters that were less than clinical reports and more of almost a status update.
Yes, it's wonderful.
So you guys are using it almost as like a triage system.
Yes, yes. Actually, we have a few patients that have really taken on to web encounters, and I've been really pushing that with my patients because as we've grown as a practice from just me to having multiple providers and multiple front desk staff, sometimes with phone calls and trying to get an information or questions for the provider, by the time the message comes to me, it may not be as clear, and I have to call the patient and I have to, ask them what's going on. It takes a lot longer to do it that way, but by having patients log on to their Hilo and send me the message, it's been wonderful because then I know what is urgent, what is not urgent, when they need to come back in. And we had a patient that was calling and saying that, I saw her daughter a few days ago and she was having difficulty with one of the antibiotics and taking it, and but was doing better, and so it was a status update, and it was great because that way the parents feel like they're heard and all their questions are answered, and it's easy for me to send back information to them.
And in doing this, you're allowing them to give you an update without an unnecessary trip to the office, thus improving customer satisfaction overall.
Yeah, I mean, and sometimes though the messages may actually create an office encounter. So they will ask me a question and say, well, my child has been having this, what do you think? And I'll say, well, you know what, we haven't had a visit in the last couple of months, why don't we go ahead and schedule? And you can actually request the appointment online, then go ahead and schedule it. We're rolling out open access to be able to schedule their own appointments as well.
I think it's important to talk about the Ask a Doctor feature on Patient Portal, because I remember when I was a trainer back 7 years ago or whatever it was now, a lot of people were hesitant to enable that feature because they thought they'd be inundated with questions from their patients without really any time to sit at home and relax.
Yeah.
But you found that to be quite the opposite.
It's been a better way to communicate with me, and it helps me know what the needs are. So, I mean, I can schedule an appointment if an appointment is needed. I can answer a quick question. It really saves time with phone calls because a lot of times either they will leave messages and I'll, spend in the evenings I'll call people back, and sometimes I can't reach them and it's difficult. But when I am able to just go online and just type it, I rarely have to make phone calls for those patients. So it's been a great way to really push that communication with our patients.
I think that's an important functionality that if you use it in the right way and you have the right clientele, it can be very rewarding for both provider as well as patient.
Yes, I mean, it really cuts down on the phone calls. So the phone calls is what you're paying for your front desk staff, and it's your time. So it's, in between a patient, I can see that I have a web encounter. I can send a one-sentence response or several sentences, and the patient is satisfied.
Another thing that you guys are doing really well here is the usage of Messenger and campaigns.
Yes.
We even got a notification for your daughter's physical update while we were prepping for the show.
Yes.
So how's that been a positive effect on Kids First?
It has been great in reducing our no-show rate. A lot of our patients may forget that they have an appointment or what time the appointment was, and they'll say, well, I got an email to remind me and I had almost forgotten, or I got the call. We did notice that if for some reason there was any issues with Messenger, and if the system was down for a couple of days, we saw that our no-show rate actually doubled, and we had quite a few patients that were not reminded. It has definitely been useful and worthwhile. I love the campaign feature, and I was introduced to it at the national conference last year, And we started using it for the birthday reminders, and I think that's something really nice to do for our patients. Very easy to set up, and the other new features that I've seen in campaign that I actually loved are the pediatric preventative visit reminders, the 2 months, 4 months, and so and being able to send education material ahead of time, because that's something that I had wanted to do. I didn't know that eClinicalWorks was doing that already. So I was going to try to find a way where we can send educational material ahead of time. So that's been wonderful, and I think, you know, sometimes we forget that there may be new campaigns that we haven't seen before. So it's also a good idea to always look at the system and see what's new.
Well, and that was another thing that you had mentioned.
Yeah.
Something that they do here at Kids First is every, 2 weeks or so, you guys get together and kind of talk about your experiences with the program,
Yes.
what works, what doesn't, and
Yes.
then try to figure out new workflows so that you're not stuck in that stagnant workflow that you initially started off
Yes.
from your initial training.
Yes, and we've had 2 trainings since we went live 6 years ago, which is, definitely we need to have continuous training. But sometimes some people have frustrations of, where the system's not doing what it's doing for them at that moment, but really that problem may have been answered, and that, going through the system and looking and seeing how we can improve our documentation, how we can train our staff is so important that we decided to do regular meetings, educational sessions for our nursing staff. We'll probably end up doing another training soon because we haven't had one since we went with version 10. So it's been wonderful to be able to just constantly be willing to let go of original workflows and look at new workflows. And I think in life, that's, technology changes on a regular basis. And
Absolutely.
in the last 5 years, we don't check emails the way we used to, or, so it's been, it's essential part, I think, of any practice. They need to constantly look at their workflow.
Definitely, and I think that's a good takeaway from the show in general. A lot of people out there that I've spoken to over the years don't really look back at what they're doing and what they're doing right versus what they're doing wrong.
Yes.
And attempt to integrate new functionalities, new features that we roll out whenever we do,
Yes.
that they can potentially integrate into their existing workflow. So that's important, and thank you for that. Another thing that you guys also constantly tweak and modify and look to improve are the way you guys use flow sheets.
Yes.
You were a big advocate of structured data throughout the program.
Yes.
Can you talk a little bit about how that's aided you in the process?
I think for certain quality measures that we want to track, it's important to use structured data so you can report on it, but also so you can compare from previous visits. For example, we use it for ADHD and well child exams and asthma controls. So with ADHD, we would ask them to do a Vanderbilt questionnaire, which would be how their symptoms of ADHD are on that particular day. So we're able to see the scores from that day and compare it to previously. So sometimes the child may have had a rough week and the parent will say the medicine is not working, but you actually look at over time and say, well, it seems to be actually better on this medicine, and I can show them the flow sheet and they can see that there is some improvement, and the teacher says that there's some improvement. So it's very good in being able to compare multiple visits. So that has been very useful for us.
And the other aspect of it was the side of structured data, where you guys said you were documenting certain scores of tests, and people were potentially documenting it in different ways, not keeping it uniform. So that was another way of aiding in the process of keeping your documentation uniform, of being able to track and trend without having to interpret what one person's interpretation of something was versus a standard.
So we don't have to go back to a previous progress note and see, when you have free text only, a lot of times you have to go back and look at previous progress notes and see what what had happened at that visit. Although we try to keep the patient seeing the same doctors, sometimes if a patient was seen by somebody else, it's important for us to be able to see that, well, actually look at the scores, they've been improving, so that has been wonderful.
eClinicalWorks offers a variety of services for you to take advantage of EBO in your practice as part of its professional services umbrella. If you are a practice looking to get started with EBO, make sure to take advantage of the free EBO webinars on navigation, practice management, and Query Studio offering. Once complete, look up the EBO class schedule in Westboro and regional offices to take your reporting skills to the next level. If you are a practice that is looking for a one-time engagement with a report expert, consider engaging with a member of the analytics team to solve your unique pain point. If you are a practice that is looking for a comprehensive engagement with a reporting consultant assigned to your account that includes discovery, report authoring, on-site training, talk to your account manager about full suite analytics services. Help eClinicalWorks unlock the value of the data stored in your eClinicalWorks database by using EBO to its full potential. Reach out to your account manager or visit my.eClinicalWorks.com for more information.
All right, well, back on the eCW podcast here at Kids First Pediatrics in beautiful Raleigh, North Carolina, with Dr. Selam Bullock. And before we get into any other questions, I did want to make mention of your guys' office. As soon as we walked in, we noticed it was very colorful, very warming, and obviously kid-friendly.
Yes.
So just a little bit about that.
We moved to this office a couple of years ago, and originally we had hired an architect and a designer, but I didn't want the typical medical office look with the furniture because kids are going to be there and kids bump their heads, and we wanted it to be not only safe for kids but actually to be something that is inviting. So we, after looking extensively for furniture and design ideas, I decided that I will go ahead and just design the waiting room furniture and have somebody build it, and just try to go with something colorful and rounded edges. As a matter of fact, the funny thing is, a few days after we opened, we noticed that a lot of our parents were actually laying down and taking naps.
Comfortable. That's one of the
Yeah.
disadvantages to making your own custom furniture for your office, but
it's held up well. It's been fun. So it wasn't as hard as I thought it would be to just draw it out and just have somebody make it.
That's awesome. Again, it looks amazing, and if you ever get a chance to stop by, you'll notice it.
Yeah.
All right. So aside from all that, you guys are big advocates of using Kiosk in the front desk, which is another thing that we noticed when we first walked in. You guys do have the old school kiosk, the big guy up at the front desk, but you guys also use these iPads here, which I noticed you've kind of form-fitted them into this little kind of foam plastic casing to prevent some of the kids from potentially dropping it.
Yes.
So how's that experience worked in your waiting room?
Well, one of the things with our, our business model, we have a lot of Medicaid patients, underserved patients. So our income isn't as high as, in a more lucrative area. So one of the things we decided was that technology is going to be the answer. So use technology and decrease your costs as much as possible. So we invest heavily in technology and started the kiosk back in 2012 because we wanted to not have to have so many front desk check-in people and to do as many things automated as possible within eClinicalWorks, which has been wonderful, is practice management side as well as the EMR side. So we put in the kiosk, and the first day that we put it in place, and this was the old letterbore kiosk, the first day half our patients checked in on the kiosk. So
without really any direction.
Without any direction.
That's awesome. So,
and it's, since then I think the Spanish has been more recent. So
yep, the translation to Spanish, and again, being in a large Spanish-speaking population area, that's definitely helped out. But you guys are also pushing a lot of questionnaires out so they can access the portal and fill out anything that they might not be able to at home.
Yes. So, some of the benefits of creating questionnaires from our EMR so that they're able to populate, the HPI and the history themselves. We're still in the process of rolling it out to where it would make sense with time and not be something that will take them too long to do. So it's a lot of trial and errors as we're incorporating that. But we found that adding the iPads would make it easier to do the questionnaires, because when they check in and they check in the on the kiosk, sometimes they may need to continue to do the questionnaires, and we take them back to the room and they're able to finish it in the room. So which is why we did the kiosk on the iPads as well, and we got these funky, colorful handles so that it would be more secure for the iPads. They wouldn't get broken as easily, and they wouldn't walk away as easily as well. So they've been great in getting as much information as possible.
When they first announced that the iPad was something that you could have your kiosk on, I think a lot of people were concerned about people dropping it in the waiting room or it not being secure or safe. But I think this is a great idea if any of the clients out there are looking for some type of protective device or some way to integrate it into their waiting room and make it a little bit smoother.
Yeah.
So that was another thing that I thought was really great that you guys are doing here. Another thing that, again, as we're having people fill out information in the waiting room, more often than not, they're filling out a lot of their screening forms.
Yes.
You guys are currently using Chatez, Child Health and Development Interactive Services, I believe is actually what system. Is what it stands for. And the people at Chatez are allowing us to push out ASQ questionnaires as well as other early childhood developmental screening tools that we can push out to a web portal and potentially fill out. Well, again, they're filling it out here on an iPad in the office. Can you kind of talk about some of the advantages that you have experienced personally with Chatez and having that web-based functionality?
So a lot of times when you do developmental screens, they come in and they fill out, for example, the ASQ or the PEDS test, and they manually fill it out, and then we have to score it and put it into the system. And one of the things that we found, first of all, the time and the ability to be able to do that at home with Chatez, and we found that it was very beneficial. And for us, it actually came out to, when you consider all the costs of the time savings in using Chatez over just paper forms, it was a huge savings. But also with Chatez, we're able to get some of even Bright Futures or pediatric specific patient education that is built into it. One of the things we're piloting with Chatez is the concept of patient-specific templates, where we have the parents fill out the questionnaires, and as we're reviewing the questionnaires about their social history and things like that, and it gives us feedback and resources, and we're able to send it out to them or print it out. So, at the conference last year, we had talked, I came to you because I knew that you were looking into ways of getting us more pediatric functionality, and I think that this would be a great way to add much more functionality than just the ASQ and questionnaire screening, but to actually have educational resources that's built in, that's based on that specific. Yeah,
because initially we were talking about potentially building the forms directly in eClinicalWorks, and then you had mentioned Chatez because you're actually using them as part of the CHIPRA.
This time I am, and I actually had used Chatez several years ago, and we stopped using it because it was difficult to get that information into eClinicalWorks. So one of the things when we were doing the CHIPRA grant and going through the pediatric functionalities, things that were eClinicalWorks did very well on a lot of the measures. There's 700 measures in the CHIPRA D grant for pediatrics, and the ones that we considered important and are based, as essential functions of any pediatric EMR were a lot of developmental and screening areas. So when looking at those measures, Chatez met so many of those measures that I felt like it would be a much quicker way, and it's something that's been around for years, and that's been interfaced only with one or two other EMRs. So we thought that it would be great, and they are also part of the CHIPRA grant. Part of the grant gives us a year of Chatez, but even getting Chatez in itself, paying for it, I think is definitely worthwhile.
Yeah, you mentioned in the discussions that the pricing for Chatez would still outweigh the benefits or outweigh the disadvantages because of potential reimbursement for some of the ASQ screenings that you're going to be able to do with some of the payers that you're obviously contracted with.
Yes, but a lot of those are Bright Futures based screening that we should be doing anyway, and a lot of people are doing. But if you were to take each of those questionnaires and buy them individually, and an online-based pre-visit questionnaires, the cost is actually cheaper to do it through Chatez. Yeah. And even the interfaced, Chatez product will make it a lot easier. Well,
and again, at that price point, we saw value to it, and again, as I previously mentioned, we are currently working on building an interface for it. But to give a little bit more detail to some of the viewers at home, the Chatez functionality currently it's a web-based platform where you can kind of assign different screening forms, different questionnaires to your patients, which much like our patient portal, we'll send a notification and say, hey, go out and fill out whatever questionnaires have been assigned to you based on what age or whatever form you feel necessary at that age in the child's development or whatever's going on. And much like they currently do it, we're actually going to integrate it into our patient portal.
Yes.
So from the front end of the program, you'll be able to see the list of questionnaires that should be filled out by the patient. If they're not filled out, again, we'll give you a notification and let you potentially hand them an iPad or some way of actually filling it out live. Also, the physician could potentially do it too in the room.
Yes.
And then that information will flow back into the progress note. Yes. You'll see not each and every question, but a rough interpretation or the actual result, as well as the form itself will be stored in patient documents.
Yes.
So you'll be able to see all of the questions and answers as well as the actual end result, the score. And then again, you'll potentially be able to sign other forms, and going forward in the future, you'll be able to review that information as, again, a part of your patient documents. So we will have an integrated platform of Chatez, again, up and running, hopefully, definitely before the end of the year. But that's kind of one of the big things that you had mentioned was a huge benefit to your practice in using, and it's really aiding the process in the room for your patients. Because again, they're not going to have to, you don't have to have an MA sit and have them fill out all those questionnaires and potentially transcribe it back into eClinicalWorks.
Yes, the transcription's been the biggest problem, so that, having it interfaced is going to make such a big difference. I think a lot of people would actually get Chatez if it was interfaced. So I think that would be wonderful.
All right, well, thank you again for sharing everything that Kids First is doing so right with eClinicalWorks. We appreciate you taking the time to do the show with us. And on behalf of everybody at eCW Podcast, as well as everybody here at Kids First Pediatrics and Dr. Selam Bullock, thanks for joining us. Please check out our podcast on YouTube, iTunes, and my.eclinicalworks.com. And we'll see you next time.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.